Are your knees hurting doing basic things like climbing stairs, walking, even things such as standing? Well, you could be one of the 50 million people worldwide that are suffering from arthritis. Now, I just made that number up, but it's a big number and it is the #1 leading cause for joint replacement surgery. Hi, I'm Marius from MariusVisser.com, and I'm going to show you 5 things today that I do with my patients that not only helps them move better, but also helps alleviate their arthritic pain. And welcome to MariusVisser.com, my platform where I help people from all walks of life, especially the elderly, helping them overcome their obstacles such as pain and dysfunction. I also have a platform called the Academy of Movement, which you will find straight off my site, which allows you to do rehabilitation in the comfort of your home. So let's get into #1 of our 5 exercises. Okay, so the first thing we do is get ourselves a nice bed or a platform where you can sit and just let your legs hang off the side without touching the floor. A high bar stool might work, your bed, a table, anything that you can find that obviously is going to be strong enough to hold your body weight. Let me show you how that works. And here we go. All we are doing now is we're just giving these old joints a good swing and a nice warm up. So while you are moving your legs, I want you to feel, you can actually feel for temperature on the knees. Do they feel warm? Do they feel cold? Do they feel swollen? Are you hearing any crackling noises? Okay, so start engaging with your knees, just making them feel like you're actually now connecting with your knees. All right, so you're going to be doing this for a few minutes. And then I would like for you to try and see how straight you can make your knee. All right, let's see. See the other one straight. As straight as you can, pull that toe up, bring it down, pull the other one up, pull that toe up, as straight as you can, and then slowly down. And we repeat on the other side. Pull the toe up as straight as you can and slowly down. And again on the other side, pull that toe up straight as you can. Try to lock the knee out, hold for a few seconds, and slow down. And we can just try that and see whether you can get full knee extension if that knee locks out. And then from there, you can actually feel the quad muscle starting to engage and the knee starts warming up. Nice, warm, fuzzy feeling. And that is the first of the 5. Okay, so next up, I'm going to introduce you to something that might frighten you a little bit, and that is sitting into a deep squat. Now, before you freak out, I know lots of you are too scared to go down with your knees because you're afraid you might not come back up again, but it is okay. You can start with any height of step that you feel comfortable with. Maybe keep something next to you that you can assist to pull yourself up, off, or you can just maybe pivot and turn and put your hands on the box or chair to help you up again. But this is a vital part of helping your knees to actually recover a little bit from the arthritis, and also to bring in a little bit more mobility into your knees. You see, we don't like stretching our knees too much, especially when we're close to that 3rd, 4th stage of arthritis. So what we want to do is we want to do this more in a natural way, and there's nothing more natural than you just sitting as low down as you can into a sumo squat position with your heels as close to the box and your hips or your bum shifted towards the edge of the seat. As you can see, I've got my heels right up this box. This box is approximately a 30 centimeter box. You could prop it up with pillows, or you could raise it with anything you can, which might minimize the angle of your knees like that. And if the knees are very tight and very painful, you can start with your feet a little bit further away from the box. But what I would like for you to do is, as the longer you sit here, because you're going to be spending a few minutes in this position. So what I want you to do is I want you to move your feet as closer to the box as possible. Keep it there for a few seconds, maybe 10, 30 seconds. As soon as it starts feeling like it's easing off again, you're going to move your heels closer and closer to the box. Now, this might take some time. This can take a few days, it can take a few weeks for you to gain 10 to 15 extra degrees, but that 10 or 15 extra degrees of range of motion in the knee is going to make a huge difference in your overall movement and pain scale. So after you've been sitting like this for a while, I want you to move your hips. So you keep your feet in place and you move your hips closer to your heels by walking until you're at that point. And then I just want you to sit and relax. Take a deep breath and breathe out, because by now it feels like your kneecaps want to shoot off. But try to keep this position for as long as you can, because the actual secret sauce is coming now. So what we're going to do is you are going to push your feet into the ground as hard as you can, as if you are trying to get up. And you're going to hold that contraction for 5 seconds, and then you're going to relax. You're going to push down into the ground as if you want to stand for 5 seconds. 4, 3, 2, 1, and relax. And you'll actually feel all the muscles around the knee contracting, the hamstrings, the quadriceps. All these muscles are now co-contracting to actually help bring more mobility about the knee. And let's do one more and go. 5, 4, 3, 2, 1, and relax. And now we are going on to number 3. Okay, so number 3, and hang on, we're not at the beach yet, we can't relax, we've still got 3 more things to do. You're going to find yourself a floor, or you can do this on the bed if you don't feel comfortable going down to the floor, as long as you realize that the end goal of any type of rehabilitation, especially that I do with my elderly people, is to get them back onto the floor so that they can get up off the floor. So that is the vital part of any rehabilitation program. So what we're going to do first is I'm going to lie back, and we need to get our glutes firing at the same time as we get our quads to stretch out a little bit more. There are so many things hidden into just this one movement pattern. I'm not going to go over all of them. This is great for lower back, this is great for hip health, this is great for lots of different things. But today we're only talking about the knees and how we're going to improve your knee health. So find a floor, lie back. And in the beginning, it will be difficult to get your heels to touch your fingertips. If you can get your heels to touch your fingertips, it means that your arthritis is probably in stage 1, maybe stage 2. But for those of you who are on stage 3, stage 4, your heels are probably going to be further away, kind of like this. Now, the one thing that we don't want to encourage is the hamstrings kicking in or cramping. So what we're going to try and do is keep the heels pushed through the floor as we breathe out and lift with our hips as high as we can to the top and come down. Now, the breathing is very important. You need to breathe out on effort. So as I'm lifting, I'm first taking a deep breath in, and as I breathe out, I am lifting as far as I can. Breathe in and out, and you will feel the top of your legs, your thighs, your quad muscles will stretch. In fact, you might only lift up to that position there. Because of the tightness in your quads, the glutes are trying to fight that tightness to try and push you through into a proper hip extension and come down. So your goal is to lift until your knees, hips and shoulders are in the same line. And we can do 10 to 15 of those. We relax a bit. But before we do the next set, I want you to see whether you can now move your heels a bit closer to your fingers. And you should be able to move, even if it's just a couple of inches. Keep moving until you feel the tightness and you can't anymore. And then we repeat our second set and we do the same thing. Now you'll find that your hips will stop there for maybe the first 5 or so. And then as you push, your hips will go higher and higher and higher as your glutes are getting stronger. The quads are now stretching. And after about 10 or 15, we come back and rest. And we move our heels back closer to our fingertips. So this is actually one of the best ways to get your quad muscles to relax and stretch them out a bit and move your heels back to your glutes so that the glutes can do what they're supposed to do and drive the movement of hip extension. Let's move on to number 4. Okay, good news is you're staying on the floor. Fourth thing we're going to do is now get the hips to support the knees. A lot of the time the instability of the knee is driven by the hip. So we got to make sure that our hips are not only mobile, that's why we do the step sit and that's why we do the glute bridges, but also that we restore the stability and most importantly the timing of the muscles that sit on the outside of the hips. So one of those things that we can help to improve a little bit of strength. Now it's important to note we're not trying to strengthen your stabilizers, we're just trying to connect with the stabilizer. We're trying to bring back that mind-muscle connection before we can put everything back into the same chain. So what we find is ourselves in a side-lying position with your arm under your head in a nice comfortable position. You can use a pillow, of course. And I want you to imagine you are lying with your back against the wall, with your bum and your heels touching the wall. And that is actually the correct position. And then I want you to feel that you are pushing your hips slightly forward towards the floor. I don't want you to open up and move the hips with the leg. I want you to keep the hips closed, and then I want you to only lift the knee off the other knee, keeping the heel on the top foot lightly on top of the bottom foot. And you see my hips are not moving back, and the highest I can lift is about 10 inches. All right, or maybe even less. But the idea is not to see how high you can lift your leg. The idea is to feel this muscle, this glute medius on the back of the hip. You can actually put your finger there and palpate it and hold it while you're lifting. So what you're going to do is you're going to lift up 2 seconds. 1, 2, hold for 1, and drop 3, 4, and repeat. 1, 2, hold, 3, 4. And you're going to see if you can complete 15 repetitions on each side. Breathe in and out. Okay, breathing very important. We got to coordinate our breathing for when we start doing our bigger movement patterns, like your squats and your lunges, which you probably go to. If you keep following the channel, you will find your breathing is going to play a bigger role in your bigger global movements. And there we go. That is 4 down, 1 to go. Okay, and now that brings us on to our 5th and last exercise. So these are more than just exercises. They are movement drills, they are patterns, and every single one of them is very specific to a specific joint and a specific movement pattern. So practice these, because this will take you further onto your journey into being more active and doing a lot more things. So we are saving the best for last. And what you're going to need now is to find a step, and it can be any step in your house. Depending on the height, you might want to go for between 15 and 20 centimeters. You can also go a little bit higher depending on what stage your arthritis is and what level of pain you're experiencing. Now, let's talk about pain for a few seconds. You do not want to do any of these things if your pain scale is hitting a 7, 8, or a 9 out of 10. That is when you have to dial it back, and you have to stay within the 2 to 3 score of the pain scale. The reason for that is because anything more than a 4 or a 5 is going to bring about not just more inflammation and irritation of the knee joint, but also is going to limit the muscle contractibility. There's going to be some inhibition of the muscles around the joint. They're just going to switch off, shut down, because there's too much pain and your body will go into a self-preservation mode. But the most important thing about pain is to keep that pain score below a 4 and only work within where you feel comfortable while still pushing a little bit onto that limit. Now let's go on to our step up. All right, so what we have here is our 30 centimeter step. I can make mine lower, but it is better for me to demonstrate it on a higher step, as it will allow me to show how slow I am actually stepping off the step. Now with a lower step of say 15 centimeters, you are going to have to slow yourself down even more because you are only that far from the ground. So I'm going to show you on a 30 centimeter step. You can use any one that you feel comfortable with, maybe starting with 15 centimeters and working your way up. So here is the actual trick. You will start with, you can start with the good knee or the less painful knee. Say that my right knee is the one that is painful. I will step up with the left leg. I can hold on to something. It's recommended that you hold onto a wall or a bar or any type of support. You're going to push your hips back. You do not want your knee to go over your toes like that and climb a step with an upright body position. So what you want to do is you want to push your hips back and let your upper body slant forward. And then from there, you're going to be pushing through the heel and drive through to the top. Okay, then you're going to switch legs. You're going to now again push your hips back towards your center line, going the back here. You're going to lean forward slightly. You're going to take your good leg and you're going to now slowly descend down until that foot touches. Okay, and then we switch legs again. You're going to go up with the good leg, and you're going to go down with the bad leg. Okay, so you can think of it this way. The goodie goes to heaven and the baddie goes to hell. All right, and there we go. We keep repeating that. Make sure that your knees on both sides don't cross over the line of the toe, and make sure that you feel your actual glutes doing most of the work. You're going to feel some quad getting involved, but I want you to slow it down, slow it down, slow it down. Okay. If there is no pain in the right leg coming down, which there should be minimal, but not too much, you can try stepping up with the sore knee. Again, very important, push the hips back, lean slightly forward, but lift the chest a little bit so that you've got this little bit of a hollow in the lower back. That means that the glutes are now engaged, and you're going to push through the heel and up. And then the same heel down, keeping that leg on the box. So the two ways of doing it is goodie goes to heaven, baddie goes to hell. If the bad knee is not as painful as you expect it to be, you can actually do both of them on the same leg. And down. All right, and those are the 5 things I do with most of my patients who suffer from arthritic pain, but also who've had knee joint replacement surgery. See, these exercises are multi-use. We use them in our practice for multiple things. Could be lower back that we're trying to rehabilitate, could be hips we're trying to rehabilitate. But a little bit more specifically today, these are for arthritic knees and joint replacements. So, if you like this video, please hit the subscribe button, hit the like button, leave us a comment, and if you'd like to see any more of these type of videos in the future, just let us know. This is Marius here from mariusspecifictest.com. Thanks for watching. See you next time.